Welcome to the Dental Capsule. In this series, we'll cover different dental topics and real clinical situations in short, easy-to-follow capsules, designed to help us improve how we manage our daily cases. In today's capsule, we are going to talk about sodium hypochlorite accident. Let's imagine this scenario. You're doing the final flush in your last endodontic case of the day. Suddenly, the patient screams in severe burning pain. Blood starts oozing from the canals, and you notice swelling and bruising developing on the patient's face. These three signs together make up the classic triad of a sodium hypochlorite accident. So, how does this actually happen? It usually occurs when sodium hypochlorite is accidentally forced beyond the apex of the tooth. This often happens if the irrigation syringe is wedged tightly inside the canal while flushing. Now the big question, what should you do? Step 1. Stop the procedure immediately. Stay calm, reassure the patient, and let them know the situation is under control. Remember, if you stay calm, your patient is more likely to trust you and stay calm too. Step 2. Irrigate the canal thoroughly with saline for at least 10 minutes. This helps dilute both the blood and the sodium hypochlorite. Don't close the tooth until the bleeding has slowed down. Step 3. Give extra local anesthesia if needed to control the pain. Then place a temporary restoration and continue treatment later, using a different irrigant, like chlorhexidine. For post-operative care, prescribe 1. A non-steroidal anti-inflammatory, like ibuprofen 600 mg. 2. A broad-spectrum antibiotic, such as amoxicillin with clavulanic acid. 3. A corticosteroid injection, like hydrocortisone, to reduce inflammation. Also, instruct the patient to apply cold packs for the first 12 hours. Then switch to warm packs starting the next day. Let them know that the swelling and bruising will usually resolve within 7 to 14 days, and they'll be back to normal. Now, the key question, how can we prevent this from happening again? Sodium hypochlorite accidents are almost 90% avoidable if you follow a few simple rules. Always use side-vented needles. Keep the needle about 2 mm short of the working length. Never wedge the needle into the canal. Keep the needle moving gently up and down during irrigation. Use the correct concentration of sodium hypochlorite. Finally, remember that teeth with an open apex, disrupted apical constriction, or large periapical lesions are at much higher risk of sodium hypochlorite accidents. Thanks for watching. If you found this helpful, don't forget to like and subscribe. Share your thoughts or questions in the comments. We'd love to discuss them with you. See you in the next capsule.